Welcome to Psychology Simplified, the channel that dives deep into the fascinating world of the human mind. We're here to shed light on the intricate labyrinth of thoughts, feelings, and behaviors that make us who we are. Our mission is to present various psychological topics, from the most complex theories to the most common mental health issues, in a way that's digestible for everyone. We believe that understanding our minds is not only for the professionals in white coats, but for anyone with a spark of curiosity. As we navigate the intricate pathways of the psyche, we aim to inspire empathy, foster self-awareness, and promote mental health. We hope that through our content you'll gain insights into your own mind and the minds of those around you. Today we delve into a critical topic, bulimia nervosa, as defined by the DSM5. Bulimia nervosa, often just called bulimia, is a serious, potentially life-threatening eating disorder. This condition is characterized by a cycle of binge eating followed by compensatory behaviors, commonly known as purging. It's not just about food, but also about how one copes with emotional distress. Bulimia nervosa is a complex disorder that goes beyond the scope of mere eating habits. It's a mental health condition that's deeply rooted in one's self-perception, emotions, and physical health. It can affect anyone regardless of age, gender, or ethnicity, but it's most prevalent among young women, particularly during their teenage years and early adulthood. Imagine a seesaw. On one side, there's an uncontrollable compulsion to eat excessive amounts of food in a short period. This is the binging phase. The person may feel a loss of control during the binge, akin to being on autopilot. The food consumed is often high in calories, and the binge usually continues until the individual is uncomfortably or even painfully full. Then the seesaw tips. Overwhelmed by intense feelings of guilt, shame, and fear of gaining weight, the person then attempts to undo the effects of the binge. This is the purging phase. Purging can take many forms: self-induced vomiting, misuse of laxatives, diuretics or other medications, fasting or excessive exercise. But here's the thing, this cycle, this seesaw, doesn't balance out. Instead, it perpetuates a dangerous cycle that can lead to severe physical and emotional damage. So bulimia nervosa is not just a diet gone wrong. It's a serious mental health disorder that requires professional treatment. It's not about vanity, it's about a struggle with self-image, control, and fear. People with bulimia can be of normal weight or even overweight. This fact often masks the disorder, making it less visible, less noticeable, but the impact on the individual's life is far from invisible. Its symptoms, as per the DSM5, are quite specific. Shall we examine them? The DSM5, short for Diagnostic and Statistical Manual of Mental Disorders, 5th edition, has laid out clear symptoms for bulimia nervosa. Let's delve into these symptoms, starting with recurrent episodes of binge eating. This is characterized by eating in a discrete period of time an amount of food that is definitely larger than most people would eat in a similar time period under similar circumstances. It also involves a lack of control over eating during the episode, such as feeling unable to stop eating or control what or how much one is eating. The second symptom is recurrent inappropriate compensatory behaviors in order to prevent weight gain. Now, this may sound a bit technical, but let's break it down. These behaviors can include self-induced vomiting, misuse of laxatives, diuretics or other medications, fasting or excessive exercise. These are all actions taken with the intention of undoing the binge eating. The third symptom is that the binge eating and inappropriate compensatory behaviors both occur on average at least once a week for 3 months. This is not a sporadic occurrence, but rather a regular pattern of behavior that significantly interferes with a person's life. Next, we have the symptom that self-evaluation is unduly influenced by body shape and weight. Individuals with bulimia nervosa often judge themselves harshly for their body size and shape. They place a high value on their physical appearance, which can deeply affect their self-esteem and self-worth. Lastly, the disturbance does not occur exclusively during episodes of anorexia nervosa. This means that if an individual has periods of time where they are not eating enough and losing weight, but also have periods of binge eating and purging, they may be diagnosed with both disorders. This distinction is important because the treatment and health concerns for anorexia nervosa and bulimia nervosa can be quite different. It's important to note that these symptoms are not just about food. They are deeply rooted in issues of control, self-esteem, and body image. They can lead to severe physical health problems like heart disease, kidney damage, and digestive issues. They are also associated with mental health problems such as depression, anxiety, and substance abuse. These symptoms can lead to severe physical and mental health issues if not addressed. It is crucial to seek help if you or someone you know is experiencing these symptoms. Remember, recovery is possible, and there are many resources available to help. To better understand bulimia nervosa, let's consider a real-life example. Let's call her Jane for the sake of privacy. Jane, a bright college student, was known for her vivacious personality and academic prowess. However, hidden beneath this facade was a grueling battle with bulimia nervosa. Jane was always conscious about her appearance. The societal pressure to maintain a certain image started to take a toll on her mental health. She began to obsess over her weight and shape, leading her to indulge in a destructive cycle of eating and purging. She would often binge eat in secret, consuming large quantities of food in one sitting. The guilt and shame that followed these episodes were overwhelming. To compensate for her overeating, Jane would force herself to vomit, take laxatives, or excessively exercise, displaying the classic symptoms of bulimia nervosa as outlined in the DSM5. Her friends and family started noticing changes. Jane was increasingly preoccupied with food, dieting, and her body image. They also noticed the frequent trips to the bathroom right after meals, her swollen cheeks, and the smell of vomit that she could never quite mask. However, Jane was adept at hiding her struggles. She would often brush off concerns, attributing her weight fluctuations to stress from college. But the physical toll was undeniable. She suffered from constant fatigue, dizziness, and her once radiant skin grew pale and dry. The turning point came when Jane collapsed during a workout session due to severe dehydration and electrolyte imbalance. It was then that her secret was out and the severity of her condition came to light. Jane's story is not unique. There are countless individuals worldwide battling bulimia nervosa, often in silence. The pressure to conform to societal standards of beauty can lead many down this destructive path. This example highlights the devastating impact of bulimia nervosa. It's crucial to remember that it's a serious, life-threatening disorder, not a choice or a lifestyle, and most importantly, it's treatable. If you or anyone you know is struggling with similar issues, please reach out for help. You are not alone. Bulimia nervosa is a serious condition that affects many people around the world. We've journeyed through a complex topic today, unraveling the threads of bulimia nervosa. It's a psychological eating disorder, a condition that can easily go unnoticed, but one that leaves deep imprints on the lives of those affected. Bulimia nervosa isn't just about food, it's about control, self-perception, and a deep-seated struggle with self-worth. It's a hidden battle, a silent war, waged behind closed doors, often misunderstood and misconceived. We delved into the DSM5 symptoms, the diagnostic Bible for mental health professionals. These symptoms provide a roadmap guiding us to recognize the signs of bulimia nervosa. We talked about recurrent episodes of binge eating, followed by compensatory behaviors like forced vomiting, misuse of laxatives, fasting, or excessive exercise. We highlighted the importance of understanding that these behaviors stem from a fear of gaining weight and a distorted body image. Through our real-life example, we saw how these symptoms can manifest in everyday life. We walked in the shoes of an individual living with bulimia nervosa, seeing the world through their eyes. It's not an easy journey, but it's one that needs to be shared and understood. Remember, knowledge and understanding are the first steps towards healing. Recognizing bulimia nervosa, understanding its symptoms, and acknowledging its impact on individuals and society moves us one step closer to providing the help and support that is so desperately needed. As we wrap up today's discussion, let's remember that mental health matters. Eating disorders like bulimia nervosa are serious conditions that require our attention, compassion, and understanding. It's through conversations like these that we can break the stigma, foster understanding, and champion for the mental well-being of all. Thank you for joining us today on Psychology Simplified. Stay tuned for more insightful discussions about the human mind. Remember, understanding is the first step to healing,